The Georgetown University Center for Excellence in Developmental Disabilities, GU-SED, presents the Transition Implementation Partnership, TIP, video series. The TIP video series was created to help parents with intellectual and developmental disabilities understand how to navigate systems in the District of Columbia. This video was made in partnership with local parents. Enjoy this video at your own pace. This video contains a lot of information and is meant to be paused when needed. You can watch the sections of the video that are most helpful to you. You can also ask someone else to watch this video with you for support. Thanks for watching. Healthcare Part 1. Healthcare for my child in the District of Columbia.
Hi, my name is Ricardo, and I am a parent of a wonderful son. I have on today a beautiful yellow shirt. I have a dark color. I have gray hair, and I am here with my wonderful wife. What's your name?
Donna Thornton. My name is Donna Thornton, and I have a beautiful blouse, color blouse on, and blue pants.
Excellent.
And eyeglasses on.
And how many children?
I have 3 grandkids, Leah, Maria, and Daniel.
Now we're here today to ask questions, and we hope this video will help other parents like us, right?
Yes.
Why is it important for my child to have health care?
Your child's health is very important, from their head to their toes. Healthcare includes your child's physical health, mental health, and emotional well-being. Having access to healthcare will support your child's growth and development. Healthcare can also help protect your child from illness and injury. Healthcare can help your child get better when they are ill or injured. Most healthcare is paid for by insurance, also called healthcare coverage. It is important for you and your child to have health insurance. A law requires all people who live in DC to have health insurance. Summary: healthcare includes your child's physical health, mental health, and emotional well-being. Healthcare can help protect your child from illness and injuries. Most healthcare is paid for by insurance, also called healthcare coverage.
What are my options to get healthcare coverage for my child?
There are different options for healthcare coverage depending on your family's income and needs. Children from many families in DC are able to get healthcare coverage through DC Medicaid or DC Healthy Families. If you receive your healthcare coverage through Medicaid, your children are probably eligible for Medicaid as well. There are some other programs in DC that provide healthcare coverage to families who do not qualify for DC Medicaid or DC Healthy Families. You can get more information about DC Medicaid, DC Healthy Families, and other programs by calling the DC Department of Human Services Public Benefits Call Center at 202-727-5355 or by visiting one of their centers. Families can also get health insurance through an employer, a union, the military, or through health exchange called DC Health Link. No matter what option you choose, your child's healthcare services should be coordinated between your family, your child, and healthcare providers. This is called the medical home model of healthcare. Summary: there are different options for healthcare coverage depending on your family's income and needs. Many children in DC get healthcare coverage through DC Medicaid or DC Healthy Families. Some families get health insurance through an employer, a union, the military, or through a health exchange called DC Health Link. Your child's healthcare services should be a partnership between your family, your child, and healthcare providers.
Can you tell me more about the medical home model of healthcare?
The medical home model of healthcare is not an actual house or home. Using the word home is a way of describing how healthcare should be provided to make sure your child's and your family's needs are met. The medical home approach to healthcare has 3 goals. The goals are to build partnerships with your family, your child's healthcare providers, and community resources. Develop a care plan for your child with you and all the healthcare providers who deliver healthcare to your child. And honor your family's culture, language, and traditions. Summary. The term medical home describes how healthcare should be provided to meet your child's and your family's needs. Your child's healthcare providers should partner with your family on a care plan for your child. Healthcare providers should honor your family's culture, language, and traditions.
What is a primary care provider, or PCP, and what do they do for my child?
A primary care provider, or PCP, plays a key role in your child's healthcare and medical home. Your child's PCP is the main professional overseeing your child's health and medical care. The PCP could be a pediatrician, family practice doctor, nurse practitioner, or physician assistant. These are all different healthcare providers that could serve as your child's PCP. PCPs diagnose and treat many medical conditions. They conduct examinations, prescribe medication, administer vaccinations, and offer advice on child health and development. They do these things for the child at every age, from the time the child is born through the teenage years. They do these things when the child is in good health and when the child is ill or injured. When needed, PCPs can refer your child to other medical providers for specialty care, such as surgeries, therapies, and mental health services. Some PCPs treat adults as well as children. Summary. The main healthcare professional that oversees your child's healthcare is called a primary care provider, or PCP. Your child's PCP diagnoses and treats medical conditions, conducts examinations, gives vaccinations, provides referrals to specialists, and more.
What are the different places where my child can receive health care services?
Healthcare is provided in different places. Where your child receives healthcare services depends on what type of healthcare your child needs, your insurance, and where services are available in your community. Your child may receive healthcare services at a doctor's office or an office that has a group of doctors, community health centers, DC government health clinics, urgent care centers, hospitals or clinics located inside of hospitals, vision centers, dental offices or clinics. Wherever your child receives services, it is important to schedule regular checkups with your child's PCP. Summary. Healthcare services are provided in different places depending on your child's needs, your insurance, and where services are available in your community. It is important to schedule regular checkups with your child's PCP.
What happens during a checkup with my child's PCP?
During checkups, sometimes called well-child visits, the PCP may check your child's height, weight, and vital signs. Vital signs means your child's body temperature, pulse, and blood pressure. Developmental progress, for example, when a child starts walking or talking, and vaccination and immunization records to make sure they are up to date. Checkups are a great time to ask questions and go over any concerns you might have about your child's health. After each checkup, you can ask for a summary of your child's visit in writing. This information may also be available in an electronic medical record. Summary. The PCP will check your child's height, weight, vital signs, developmental progress, and vaccination records during checkups. Use checkups to ask questions about your child's health. Ask for a summary of the visit in writing.
What if my child gets sick?
or injured in between checkups.
If you have a concern about your child's health between checkups, you can call your PCP. If your child is sick or injured, you may want to call your child's PCP and ask for a same-day appointment. At a same-day appointment, your child may not see the PCP that they usually see. Instead, your child may see a healthcare provider with access to your child's medical records. Whether the visit to the PCP is because of illness or a checkup, it is important to keep track of all of your child's medical information. Summary: if you have a concern about your child's health, or if your child is sick or injured, call your child's PCP. If you schedule a same-day appointment, your child may see another healthcare provider who has access to your child's records. It is important to keep track of all of your child's medical information.
What can I do to keep track
Of my child's medical information and appointments.
Your child's healthcare providers will create a medical record for your child. Electronic and paper copies of your child's information will be kept at the healthcare provider's office. You can ask for a copy of your child's medical records. You may be able to set up an account that will let you access your child's medical records using a computer, tablet, or cell phone. It is important for you to keep track of your child's medical information and appointments. Find a way that works for you. You can write your child's appointments on a calendar, write a note to remind you, and keep it on your wall or refrigerator. Keep your child's appointments on your cell phone calendar. You can use a folder to store all of your child's information in one place. The folder can include contact information for each of your child's healthcare providers, important documents such as birth certificates, health insurance information, and vaccination records, summaries from checkups and other healthcare visits. It is also a good idea to keep a record of your child's medical history, including any illnesses, health conditions, allergies, medications, and test results. Summary: you can ask your child's healthcare providers for a copy of their medical records. You may be able to access your child's medical records using your computer, tablet, or cell phone. It is important to keep track of your child's medical information and appointments. While you take steps every day to keep your child healthy, don't forget about your health needs. Taking care of yourself helps you and your child. This is the end of part 1 of the healthcare system video. You can review part or all of this video. If you are ready to learn more about the healthcare system, view part 2 of the video, Understanding Specialty Care and Medical Emergencies.
What else you want to say?
Nothing.
We are parents.
We are fine.
We are good parents.
We're good people.
We going nowhere,
No, huh?
but we're going to keep on moving.
We're going to keep on trucking.
We'll keep on trucking. Oh,
Keep
so
on
throw the word
trucking.
trucking in there.
We're gonna
Hollywood,
keep on
here she
trucking.
comes.
Let's keep on trucking. Now, can we go now?
Yes, thank you so much.
This video was developed with funding from the U.S. Department of Health and Human Services, HHS, Administration for Community Living, ACL, Administration on Disability, AOD, Grant 90DDU C0086. The video content is solely the responsibility of the Georgetown University Center for Excellence in Developmental Disabilities, GU-SED, project staff and partners, and does not necessarily represent the official views of the HHS, ACL, and AOD.